My name is Rachel Jackson and this short video is about Keppra or levetiracetam. Levetiracetam, brand name Keppra, is an anticonvulsant agent which is FDA approved for treatment of seizures in patients 1 month of age or older. The precise mechanism by which levetiracetam exerts its anti-epileptic effect is unknown, but postulated mechanisms include the inhibition of calcium channels on brain cell membranes, facilitation of GABA inhibitory transmission through displacement of negative modulators, and reduction of delayed rectifier potassium current, and or binding to synaptic proteins which modulate neurotransmitter release. Here in the NICU, we use Keppra for prophylaxis and treatment of seizures, and this medication comes in oral solution, oral suspension, tablets, and IV dosage forms, but the most commonly used in the NICU are the oral suspension and the intravenous formulations. Keppra is a pretty great drug because it has less drug interactions than most other anti-epileptics because it's not metabolized by liver enzymes which metabolize many other drugs. When switching from oral to IV formulation, the total daily dose of Keppra should be the same, and in fasting pediatric patients it takes about 1.5 hours for the drug to peak, and in those less than 4 years of age the half-life of Keppra is about 5 hours. Recommended dosing for this drug can be confusing because different references list different amounts and frequencies, so this slide is very important. The recommendations listed in NeoFACS are lower than the current dosing recommendations listed here. For treatment of status epilepticus, it's appropriate to give a loading dose of 30 to 60 mg per kg. For maintenance dosing, it's ideal to start the patient at 10 mg per kg per day, divided twice daily. Then increase the dose by 10 mg per kg over 3 days to about 30 mg per kilogram per day, divided BID. Some patients require up to 45 to 60 mg per kilogram per day for treatment of persistent seizure activity or clinical EEG findings. For oral medication administration, food might delay, but it doesn't really affect the extent of the absorption of Keppra, so you may administer it without regard to meals. If you're using tablets to make an oral suspension, go ahead and dissolve the tablet in about 15 milliliters of liquid. And for parenteral administration, the vials must be diluted. It's okay to dilute a dose in normal saline or lactated ringers or D5W to a final concentration of 15 milligrams per ml. After diluting the medication, be sure to check and see if it contains any particulate matter or if it's discolored because the medication should not be used in either one of those cases. Then after it's diluted, the dose may be infused over 15 minutes, or if the patient is in status epilepticus, a rate of 2 to 5 milligrams per kilogram per minute is appropriate. Some great things about IV Keppra is that it does not contain any preservatives, and it's not known to commonly cause phlebitis. Storage for each of these formulations that we have discussed is just room temperature. Levetiracetam is compatible with many formulations including valproate, diazepam, and it can also be diluted in the things that we just mentioned, the D5W, LR, and NS. Adverse effects that you may see due to levetiracetam are highlighted here. Hypertension, or specifically diastolic hypertension, is one of the most common adverse reactions. Isolated elevations in diastolic blood pressure measurements have been recorded in children less than 4 years of age. However, no observable differences were noted in mean diastolic measurements of children receiving levetiracetam versus placebo. Similar effects have not been observed in older children and adults. Other adverse effects that are pretty common include constipation, diarrhea, vomiting, agitation or irritability, and also drowsiness. Levetiracetam has very few drug interactions. However, I have a couple of notes here. Keppra may enhance the toxic effects of carbamazepine or CNS depressants, which we don't commonly use in neonates anyway. One other drug interaction to note is that phenobarbital may decrease the serum concentration of Keppra, reducing the effects of Keppra. So if you're giving those concurrently, that's something to keep in mind. Since I brought up phenobarbital, let's compare the differences between these two anticonvulsants. Phenobarbital binds to GABA, resulting in inhibition of excitatory neurotransmitter release, whereas levetiracetam binds to brain cell membranes and synaptic proteins, inhibiting neurotransmitter release, and also decreasing neuronal excitability. I mentioned that IV levetiracetam has no preservatives. However, some phenobarbital injection formulations contain benzyl alcohol, which has reports of fatal gasping syndrome reported in neonates with symptoms of gasping respiration, hypotension, bradycardia, and cardiovascular collapse. When phenobarbital was studied in animal models, it caused neuronal cell death. In a 2013 retrospective chart review, they evaluated 280 neonates for neurodevelopmental effects who had received either phenobarbital, levetiracetam, or both drugs for treatment of neonatal seizures. And a subset of that study group, made up of 67 patients, had a Bayley Scales of Infant Development scoring completed at 24 months corrected age. Based on the analysis in this retrospective review, neonatal exposure to phenobarbital in the study was associated with a large, significant reduction in cognitive and motor scores, so that was 8 to 9 point reduction, and an increased probability for the development of cerebral palsy. Levetiracetam has not been found to have the same effects on neuronal development. And another thing, it hasn't had the same increased probability for the development of CP. Another thing to consider when comparing these medications is to remember that levetiracetam has less drug interactions and less adverse effects when compared with phenobarbital. The monitoring parameters for levetiracetam are outlined here. It's important to document seizure frequency, duration, and severity. Also, a CBC can be important to monitor because Keppra can cause decreased neutrophils, decreased white blood cell count, and eosinophilia. Some other considerations with this medication is the possibility for withdrawal. Anticonvulsants should never be discontinued abruptly because of the possibility of increasing seizure frequency. Therapy should be withdrawn gradually to minimize the potential of increased seizure frequency unless there's safety concerns that require a more rapid withdrawal. As far as cost, the IV formulation is slightly more expensive than the oral solution in suspension, and I have a quote that I got from Lexicon. The oral solution of levetiracetam, if you were to buy 473 mLs, would be a little over $300. And then the IV formulation of levetiracetam, same amount, 473 mLs, would be about $435. Thank you so much for watching my video.